ineffective handling is also related to so many areas. Say, for example, the migrant workers. No, for example, in the unlock phase one, what happened is the government announced it's a very drastic decision. No? So they make the announcement today on 23rd afternoon, and it was enforced from night of 23rd August to 23rd March onward. No, so which means a lot of the people who work in the cities, who work in mega urban areas, no, like Mumbai, Delhi, Kolkata, they were stranded. And the government, they were unable to provide necessary support for them, in terms of the transportation, in terms of the food, in terms of the healthcare. So what happened is a lot of the migrant workers, they all concentrate. So these are not in thousands, no, these are in huge numbers, no. So what happened is a lot of them were concentrated, and then and several people were forced to walk to their home, around 300 kilometers away, 500 kilometers away, so which means a lot of people died just while returning back to the village. And then, and I think, so that is there, and then unlock phase two, when people are starting to relax, the government relax the travel. So there are special trains, errands to bring back those stranded people, in different cities and towns after almost 1 month, 1.5 and 2 months. But it was too late, no. So even the process, even in the way how the people are brought, very limited number of trains carrying large number of passengers. They all come back, and then those are the people who start infecting the people in their own state. No? So then that led to a exponential rise in the number of COVID infection in those states. So when the COVID case comes up, and when there is an exponential increase in the number of cases happens, then the health infrastructure, existing health infrastructure, is unable to cope up with the situation. No? And I think this is happening in many parts of India as well. So then ultimately you could see that very soon in many government-run centers, they become saturated, no, because they can no longer accommodate the number of people who are affected. The lack of testing facilities, no. I think this is for a long time. The initial days, it has been a prolonged challenge. Now, one is the testing facility, because you want to check, test yourself, but you don't have the facility. There are limited facilities where you can go and conduct tests. No, so the testing facility itself it continues to be a big challenge now. No, and then because some of the testing facility, even if you have, it takes long time, no, to get confirmation of your results. And then another one is the issues of the lack of PPE, the protective PPE protection equipment. And there are several situations where doctors, both in government hospital and also in private hospital, they complain, they protest, demanding appropriate and adequate, and not just provision of PPE, but also the quality PPE. A lot of the urgent patients, urgent COVID patients, or even other patients who need urgent medical care, they could not avail medical facilities. So, and like in several districts in Manipur, just recently 2 people died because the doctors in the the primary health centers, the doctors are unwilling to take care of urgent patients because they're worried that they might be affected with COVID. They refuse to take care of the medical needs of the patients. So 2 people have died in Manipur. So there was a protest by the families. So what happened now? Because the economic impact is one of the biggest impact of the COVID lockdown. No, the direct impact, and in the initial days, the direct impact is felt by the migrant workers, people who are stranded, who lose their job, who don't have the money to go back, and then the government failing to provide necessary provision, economic support, and also the travel support, and so economic impact is directly felt by the migrant workers first and foremost, and then second is a lot of the Delhi wage earners, they got affected because suddenly the lockdown, and then the people who run small vendors markets, they cannot sell or market their local producers. So that is, and this continues to be impacted. And then in the second lockdown, the government talks about opening up the economy, thinking of the farmers, and then permitting some of the farmers agriculture work, But then what we're also seeing is, even if people can go to farm, like people who cultivate seasonal vegetables, and like in Manipur, for example, the pineapple, because pineapple is one of the seasonal fruits. People harvest a lot of pineapples in different hill areas. So now the problem is because of lockdown, you cannot sell the pineapples, for example. So a lot of the small-scale farmers and indigenous communities who grow different seasonal crops and fruits, they cannot sell. So now this is one of the biggest economic impact out here. And then small scale agriculture producers. So now even if they have produced vegetables, gourd and then garlic and then this chili and then many others. So now they cannot sell. So this is one of the biggest. It affects the local economy. It affects the indigenous trading system as well. Out here, despite the economic impact, despite the lockdown, the government continues to push for policies that favors corporations. Say, for example, during the initial phase of the lockdown, the government pushed this policy called Draft Environment Impact Assessment Policy 2020. Bill. So this is a bill which will take away or exempt several corporate bodies like mining companies and oil exploration companies and other strategic sectors, which government defines, from conducting environment impact assessment and from conducting public hearings. So, and there is a lot of worry that by removing this, the needed necessary environment impact assessment and public consultation process, it will favor corporate bodies to aggressively pursue their extractive industries. And then just recently, there was an eviction of communities who are affected by this large infrastructure project. So there is a road project which is financed by the Asian Development Bank. And there is a place for called the Khomchang to Tamenglong. This is quite interior parts of Manipur, But then, so they wanted to expand the road project, and then so there's some eviction. The people were affected as well, Another challenge is a lot of people who are affected by the lockdown, So they also have complaints that yes, the government comes up with this initiative to provide food distribution to people who are affected by the local public distribution. So, but then there are complaints of corruption and inadequate monitoring, and so there's a lot of complaints in the media. And then there are several groups who file complaints with the National Human Rights Commission, with the Manipur State Human Rights Commission. So there are a lot of complaints around, the violence by the police and this thing. So, but I mean, it has subsided a little bit, after the initial this thing, but then it continues to linger, Say, for example, in Tamil Nadu, just last month, I think last month and just early part of, June, later part of June, 2 people were arrested by the police, in Tamil Nadu for violating the lockdown, because the lockdown was extended till some 5 p.m. or something. And there was this 2 shopkeeper, they had opened the shop beyond 5 p.m. So the police arrested them, and then 2 people, they were killed, And there were a lot of, so there were protests in Tamil Nadu, and then, so like it's an excess of the police atrocities, and so there are a lot of complaints, a lot of protests in Tamil Nadu, I think where father and son duo, And then another area is also the increased surveillance, monitoring of people who are critical of the government response. So like in Manipur, at least 4 to 5 people were detained by the police, arbitrarily for questioning the government response to the pandemic. So the human rights group here, we're compelled to come together and issue a joint statement, and we are also compelled to file. Even our organization, we team up with different human rights groups in Manipur, and we filed complaint with the Manipur State Human Rights Commission, and then also with the National Human Rights Commission. So there were around 4 to 5 people who were arrested. So we not arrested formally, but they were detained. So it's like a threat and intimidation, But all of them were posting in the Facebook, social media, So the government were monitoring their social media, and then. So then we intervened, and then but then of course they were released, But then they were released, but still, it was a threat and intimidation in that sense, I mean, most of the restriction is imposed under this Disaster Management Act, This 2005. So they use different provisions of disaster management, they're saying to impose restrictions and also to detain violators, and then of course there are a lot of people who also got detained because they're violating the SOPs, and this is, so most of it is carried out under the Disaster Management Act 2005.
So they're most likely abusing some of the policies in that act, right?
Especially during the initial days of this thing, and then even the people who are detained, so a lot of them are detained under this provision. So there were a lot of complaints around this. Yeah. So when you file complaint with the National Human Rights Commission, we also cited the inconsistency of the COVID response with human rights provisions and this thing. So one of the area that we highlight and emphasize is the need for respecting and centering around human rights based approach. Whenever you respond to COVID pandemic. Yeah. But then when the quarantine centers were established, so they were mixed response, because when the number of cases rise out here, especially after people were brought by train, migrant workers, and then people study. So then when the case suddenly started growing gradually in Manipur and nearby areas, so then the ideas of converting quarantine centers, establishing quarantine centers in the schools and colleges and universities, it already started, And then, so they were, initially some communities were not very happy with that, because they were worried that if you establish quarantine centers within the community, it might spread to the community, So they were reluctant. But then the government and also with some of the civil societies intervened, convincing the community members to allow opening quarantine centers in the schools and colleges and universities and all, So it happened. So there were also a lot of support coming in from the communities also, in terms of providing food and medical care, and then also some recreational measures, like psychological support, mental support. Another interesting development, especially this is again in the initial days, when the lockdown was enforced, and then because of the lockdown enforced, a lot of people were deprived of food, and then the shortage of food becomes imminent, and then so what happened is a lot of the communities, nearby villages and all, so they start sharing food. So people who have more food, so there are good examples. There's a village called Koksabung in the northern part of Manipur, for example. So the neighboring village, because they have more land and they have more forest produce, and then they have more seasonal vegetables. So they start sharing their surplus food with the neighboring villages, who also depend on agricultural land. So it sets a very good example. And then, a lot of communities in different parts start emulating that. So now, and till April, a lot of different villages from different parts, they shared food with others. So, and now, because now the response, because the case has gone exponentially, because it has gone beyond quarantine centers, it spread, frontline workers, and then so now, right now, just last week, so now the major civil societies in Manipur, it comes together and establish a COVID task force, civil society COVID task force. So, and then and what one of the biggest issue is the issue of information, because the government shared information through telephone, through TV, through whatever, but still it seems inadequate, So now the COVID task force of the civil societies, it takes up the initiative to take the awareness, awareness to make sure that the families and the villages are taking up their own initiative, apart from shutting down community. So those kind of initiatives is coming up as well, yeah. And then in some areas, like we have in village called Ukrul. Ukrul is one of the district in Manipur, the northeastern part. So the civil societies out there are organizations like the Tangkhul Naga Long, Tangkhul is one of the communities out there. So they imposed 7 days complete lockdown. So when the government was easing the relaxation, in unlock phase 2 and unlock phase 3, unlock phase 2 especially. So this particular community, they enforced complete lockdown for 7 days, in the entire, in all the villages covering in their domain, So that is also one of the community initiatives to control COVID. The initial days when people were, several people were responding, civil society or some groups were, were coming up with alternate views and critical of the government response. So they were intimidated and detained and summoned arbitrarily. So there were some incidents like that. The continued raising of awareness is really, really, really important, because from our part also, because among our civil society, among our community, there are people who follows the SOP. So it's really, really important even for us to take care of that, So to maintain the SOP, and then so that is there, and then we really will continue to pressure the government to make sure that all the necessary facilities, in terms of medical facility, in terms of provision of necessary food and other basic essential needs are duly provided, So now another focus now is like there has to be an increased testing facilities, because with the community spread increasing, so now the concern is a lot of the community members who wanted to get tested, they cannot do it now because shortage of equipment, and then the delays, the time, and then the exponential number of people who wanted to get tested, who should be tested. No, so so we will continue to pressure the government out here to make sure that the necessary testing equipments or testing facilities is enhanced. No, the capacity to test is increased substantially out here. And then another area is, as I said, no, because any COVID response in whatever form, it has to adhere to human rights standards, human rights principles, no?
Yes.
Because every people have the right to express their concern with the government response, and that concern is increasing actually. You know, look at the quarantine centers, look at the medical institutions, look at the from the community, for example. And the testing facility, and then in terms of the infrastructure, sanitary, and whatever. So it had the loopholes, and then now the infection is increasing with the frontline workers, now with the nurse, with the doctors, with the police, with the this thing. So the quarantine centers, the testing facilities, the immediate response, it has to be strengthened, no, in all areas. So yeah, and then it's really, very important to listen to the community, listen to the voices that identify the lapses and loopholes within the state response, no. And finally, we will continue to strive for the protection of people's land and resources, no? Because because at initial phase of lockdown, when villages start sharing food, and I think that is possible because a lot of the villages who could share food is because they have forests, they have land, they have resources, they have the river, and so they are under the full control and management of the communities, no? And because of that only they can, and it really helps in building up resilience to the COVID pandemic, no? And when the government is dealing with difficulties to provide food support to the villages or to the most needed communities, but then the communities are coming up and then they are able to share food, no? And I think that's really, really helpful in this hardship and difficult times. And it's a message that we really need to protect and defend our land.
I think that's it, Jiten. Thank you very much for this interview. Please stay safe. Thank you very much.
Yeah, stay safe as well, and take care. Have a nice day.
You too. Goodbye.
Goodbye. Stay safe. Yeah, thanks.